I'm Dr. Mark Herber, a board-certified pediatrician at the SSM Health Medical Group. I did my medical school training at the University of Missouri in Columbia, and I completed my residency training at the Dallas Children's Medical Center in Dallas, Texas. For me, pediatrics is starting at birth, and I see kids up until their 19th birthday. So I see them all through the newborn period, all through preschool years, all through the early school years and adolescence, up until they're ready to go off to college. We can prevent so many serious illnesses by giving them their immunizations. And also we can monitor their growth, their development, and make sure they're on target for where they're supposed to be. There are so many things that a parent may not notice. They're always around their child, so they don't really pick up on things in the same way that I would have. I haven't seen them for 2 months or 4 months or 6 months. I have a different perspective and a different objectivity that they're not able to have. The other big change that's happened since I've been in pediatrics is the way we handle asthma. It's so much better now than it was when I first began in pediatrics. We have much better tools to keep it under control. Most kids now are able to live normal lives, do all the sports and activities they want to do. They have different times of the year where they might have a little bit more trouble, and they just increase their medicines at that time of the year, and then they can still do whatever they always wanted to do. When people come into my office, particularly if their child's sick, they want to know, what's wrong with my child? What am I supposed to do about it? When is he going to get better? And when do I call you back? So I make sure that we cover all those things. And I always finish every visit with, is there anything else you wanted to ask about? To make sure that their answers were all covered. And if they say, I'm not sure, I always give them the option to call back later. If you have other concerns that you think of later on, feel free to call back. We can talk some more. But I think it's really important that all the questions get answered. I've been doing this job for a while, and I love this job more now than I ever have. There's a certain sweetness in seeing the different ages of children and watch them as they grow, to see the amount of love that the parents have for their child and concern for them. To be around that is inspiring and humbling and a joy.